All right. As we know, the pandemic has definitely taught us the importance of, to get more people or educate them to care about their general health and also well-being, and also understanding their challenges and challenges of primary care during a pandemic. A company called Fever has been working towards injecting change into the traditional primary care doctor-patient relationship to facilitate a higher degree of health innovation. And also Fever is a healthcare company, a health tech company that provides affordable e-patient services through a healthcare as a service platform. It is an integrated healthcare service utilizing a mobile application to provide access to doctors anytime, anywhere, and Fever is set to significantly reduce the cost of primary care and also for corporates and consumers based on an affordable subscription model with easy access to patient health data. The spokesperson is Adlan Harkes, CEO of Fever, to introduce further about Fever in the industry. Joining us at this time, Adlan, good morning. Thank you so much for joining us this morning.
Good morning.
All right, Adlan, tell us more about Fever and how did Fever started to be healthcare as a service platform?
Well, yeah, so this is a new model for healthcare in Malaysia. And when you typically say something is as a service, it means that you're really leveraging technology to achieve economies of scale to deliver something at affordable prices. So within a healthcare context, what we actually did was we used technology to enhance and improve the patient experience, the outpatient patient experience. We also went and negotiated preferred pricing with our lab providers, and we cut out the middlemen from the supply chain for our drugs. And when you bundle all of that together and actually offer those cost savings to corporates, we're able to basically give them a subscription model that includes all consultations, all prescriptions, all lab investigations for a single price of 288 ringgit per employee per year.
So Adlan, what are the key features and services offered by Fever?
Well, so when you wanted to take that whole context of improving that whole patient experience, the outpatient experience, right, you can't exclude the physical context, but you also have to look at how you can improve that. So we do have a mobile and digital first experience, which includes the teleconsultation aspect, but you can't have that alone either. So Fever really needs to combine how you can go from the virtual experience into a physical experience, as well as get your medication at the end of it, all on the platform. And so when going back to that whole healthcare as a service, when you bundle it onto a platform and design every aspect around that from a technology perspective.
Adlan, how does Fever maybe set itself apart from other health tech or health tech industry players? Yeah, others players. Yeah.
Okay, sure. There are a lot of other players in the industry, and at the start of COVID, there were only a handful of teleconsultation companies, and certainly they proliferated during COVID. But the difference between us and a lot of the other players is our business model. So really, when you take a look at teleconsultation, it's just a tool. When you want to design a business model around it, everything is affected by the business model. So the tools need to be designed that allow for both the physical and the virtual, and for that continuity of care for users to channel through the virtual into the physical when they require, and off the back of that.
And also, Adlan, help us to understand and to comprehend further, because for the past 2 years, there's a lot of things we've learned from COVID-19, and COVID-19 certainly has brought upon, a reality check, especially for healthcare in Malaysia. What does Fever hope, to change in the Malaysian healthcare industry?
Well, I mean, one thing that COVID did bring about was it made people more comfortable with digital platforms. So certainly it reduced that need for us to convince people to get onto a digital platform, right? And moving forward, I think what we're going to find is a lot of people are going to see the importance in having access to their data. I think most of us will be familiar with actually going to a physical GP and getting medication off the back of that, but no one actually gets any consultation reports. No one actually understands their medical history. If you want to go back and look at medical history, you don't have impact moving forward.
Adlan, one of the issue is about the data privacy, security. Maybe you can share what technology features have you deployed to ensure health data are kept private and secure?
Well, health data, I mean, that's one of the most important aspects of this whole platform for us. Other than healthcare data, the other most important data would be financial data. So my partner in this FIVA project is an ex-banker, and he also designed systems for international banking institutions. And we've brought that approach and that care and that diligence to security of data into our platform, which means, from that perspective, even I can't access anyone's data. So the only people that have access are the doctors and the patients. And it's quite important in this respect that the patients are in control of their data. They're the ones that decide who can access it, who they share it with, and they're in control of the data at all times. No one else accesses it.
Even though FIVA just has launched recently, can you tell us about what are your plans for FIVA for this year?
Well, plans for this year, of course, I mean, we're going to try and target and hit our, clinic rollout. So an important aspect of having a digital platform, like I said, you can't differentiate between the virtual and the physical. So we're going to focus on expanding that physical clinic network as well. We're going to focus on our technology, and we're also going to try and hit our, of course, we're targeting to hit certain milestones with number of users, of course, but yeah.
Adlan, we can see that FIVA Digital Healthcare is, here to improve the approach of delivering primary healthcare, addressing the concerns of patients about, of getting more accessible and affordable healthcare. But how can this digital healthcare, also ensure higher efficiency level, to not only in the urban area, but also in the suburban and also rural area?
So initially when we launched, I mean, there's a reason why we're targeting corporates, right? I mean, corporate employees, there are as many as I think in SMEs that you're looking upwards of 6 million users. Now, when you actually have that embedded within the corporate companies and you actually expand that to the dependents, you're actually looking at, close to 15 million Malaysians. Now, that's going to be spread throughout the country. So we can't basically just focus on the urban. You have to basically take care of people's parents, which requires us to have partners in the rural areas as well. And of course, I mean, being a digital platform, it is universal in terms of accessibility.
We can see that FIVA is based on a subscription model with easy access to patient health data, how can it provide a potential business framework for the future with FIVA?
Well, again, so the whole concept of the technology and as a service approach means that, we can take a look at and design pricing around that, right? So from an efficiency standpoint, you look at basically needing to avoid queue times in clinics. We may even be able to avoid sending you down to a physical clinic completely, but it doesn't mean that it's not included in the package. So that's our approach to basically, yeah. Sorry, I missed the last part of that question.
No worries. Take your time. This is the morning. All right, thank you so much, Adlan Herkes, the Chief Executive Officer FIVA, for sharing insight. Now I'm going to move on to my colleague here, Harits. He will explain a bit about the healthcare industry.
Yes. Okay, when we said about the healthcare technology and also how it helps to develop in terms of the digital health interventions and also to prevent diseases. Of course, we want to look at how technology impacts and helps to develop in terms of the, for example, electronic health records, telehealth, wearable devices. Of course, when we referring back or we recap back during the COVID-19 pandemic, we see a lot of, for example, telehealth has been conducted by the Ministry of Health. For example, when there's a positive cases, the patient itself just go through online platform and also through Google Meet, for example, and they can consult with the medical experts, and they can update their current situation and also regarding their health condition. But in healthcare, actually, big data can provide a few following benefits. For example, reducing medication errors, aiding in preventive care, and also staffing more accurately. But there are some challenges. Okay, for example, if you can see that due to massive amounts of data collected, as my questions just now to Adlan, data collected from a variety system and also store and code data differently. Data interoperability is an ongoing challenge. So, meaning that if we are currently facing lots of data, but how to make sure it's safe, kept, and secure. And then additional challenges related to concern ranging from digital literacy among patients and also resulting unequal access to healthcare, issue related to like data storage, access sharing, and also ownership. As Najib questions to Adlan just now mentioned about the how about issue of inequality, suburban, maybe those people who don't have the or their digital literacy is not as high as the current or people who stay in urban area, for example. This kind of issue of inequality are part of the challenge of digital technology. Najib and also
All right, that's the one of the biggest challenges that I think we should focus on, and Astro AWANI will keep focusing on this healthcare, digitalization in Malaysia, especially